Are you noticing a few more facial hairs than you'd like and wondering why this is happening? You're not alone. This is something that comes up with almost every patient I see, and it can be frustrating, confusing, and sometimes embarrassing. But before you panic or reach for any random treatment, it's crucial to understand why this hair is appearing and what you can realistically do about it. Hi. I'm Dr. Sam Ellis, a board-certified dermatologist in Northern California, and today we're going to dive into the causes of excess female facial hair, how it differs from the hair you might see in men, and the strategies, both medical and at home, that can help. If that sounds useful, go ahead and give this video a thumbs up, and make sure you're subscribed so you won't miss the next updates on skin, hair, and overall dermatology insights. So let's start at the beginning. Every woman naturally grows some facial hair. Most of it is called vellus hair, the very fine, soft, almost invisible hair often described as peach fuzz. Compare that to the thicker, coarse hair men develop, known as terminal hair. In most women, the amount of peach fuzz you have is primarily determined by genetics. Some women, however, notice darker, thicker hair in places where men typically grow a beard or mustache. This is called hirsutism, and it represents a deviation from the typical female hair pattern. Hirsutism is more commonly seen in certain ethnic groups. Women with Mediterranean, South Asian, or Middle Eastern backgrounds may experience hair growth in the beard, mustache, or chest area more frequently. Importantly, this is usually just a genetic variation and not necessarily a sign of illness. Age also plays a role. As women approach menopause, the hormonal balance shifts, often leading to more noticeable facial hair. But sometimes, excess hair is caused by an overproduction of androgens, hormones like testosterone that influence hair growth, voice depth, and other traditionally male traits. One of the most common conditions linked to androgen excess is polycystic ovarian syndrome, or PCOS. In PCOS, benign ovarian cysts can trigger higher levels of testosterone, leading to thicker, darker hair in patterns more typical of men. Other causes of androgen excess include adrenal tumors, congenital adrenal hyperplasia, or certain endocrine disorders like Cushing's disease. It's also important to distinguish hirsutism from another hair growth condition called hypertrichosis. Unlike hirsutism, hypertrichosis can cause excess hair in areas that aren't androgen dependent. People with hypertrichosis might develop more terminal or peach fuzz hair on the face and body, and in rare cases, sudden onset of hypertrichosis in older adults can indicate a serious underlying condition, including certain cancers like lung, breast, uterine, or bladder cancer. That's why noticing sudden, unexplained hair growth should prompt evaluation by a medical professional. Medications can also contribute. For example, topical or oral minoxidil, intended to stimulate scalp hair growth, can sometimes lead to facial hair as a side effect. Similarly, women using testosterone therapy, often for postmenopausal hormone treatments, may notice unwanted hair growth. Because of this, before starting any hair removal method, it's essential to check whether a medication or hormonal imbalance is causing the hair. Once the cause is identified, whether hirsutism, hypertrichosis, medication-induced, or age-related hormonal shifts, we can start exploring treatment strategies. But here's the key. Identifying the cause first is essential. Jumping straight into hair removal or cosmetic treatments without understanding the underlying reason often leads to disappointment or incomplete results. For women with hirsutism, the first line of treatment often involves topical therapy. A cream called eflornithine is applied twice daily to areas like the upper lip or chin. It works by inhibiting an enzyme that contributes to hair growth, thinning the terminal hairs over time. It typically takes 6 to 8 weeks to see noticeable improvements, and continuous use is required to maintain those improvements. Stop using it, and the hair will gradually return to its baseline state. Now that we understand why facial hair appears, let's talk about how to address it safely and effectively. For women experiencing hirsutism due to androgen excess, like in PCOS, oral medications can play a powerful role. One of the most common approaches is a combined estrogen-progesterone birth control pill. This helps regulate hormone levels, reducing the overproduction of testosterone by the ovaries and adrenal glands. Over time, this can slow down or even partially reverse excessive hair growth. Another key medication is spironolactone, which many of you might recognize from its use in treating hormonal acne. Spironolactone works by decreasing androgen activity in the body, reducing the rate of new hair growth and thinning existing terminal hairs. The results aren't immediate. It usually takes 3 to 6 months of consistent use to see noticeable improvement. And, like with topical treatments, you must continue taking these medications to maintain the results. Stop, and the hair gradually returns to baseline. Weight management can also make a difference. Excess weight is linked to higher androgen levels in some women, so even modest weight loss may improve hormonal balance and reduce hair growth over time. It's not a replacement for medication, but can complement other treatments effectively. Beyond medications, let's talk about practical hair removal strategies you can use at home. The first and simplest option is shaving. Many women hesitate to shave their faces due to social stigma, but it's completely safe and effective. Shaving removes hair at the surface without affecting growth rate or thickness. For tutorials on safe facial shaving, I've linked videos in the description. Another option is chemical depilatories like Nair. These creams use thioglycolic acid to dissolve hair protein, effectively removing unwanted hair. But caution is essential. Always patch test first on your inner arm to prevent irritation, and avoid areas you don't want to remove, like eyebrows. Temporary hair removal methods also include threading, waxing, and sugaring. These are safe and effective, though they only remove hair for a short period. For longer-lasting results, we move into in-office treatments like laser hair removal and electrolysis. Electrolysis uses an electrical current inserted into individual hair follicles, destroying their ability to grow hair. It works on any hair color, black, red, blonde, or even white, making it ideal for smaller, targeted areas on the face. The main limitation is that it treats follicles one by one, so it's more time-consuming for large areas. Laser hair removal, on the other hand, uses concentrated light to target the pigment in hair follicles, which damages the follicle and reduces hair growth over time. It works best for dark hair on lighter skin because the laser targets the pigment. Multiple sessions are needed, and while many people see a significant reduction, hair may return if hormones shift later, for example, during pregnancy or menopause. Some patients ask about at-home laser devices. While these can be convenient and affordable, they are far less powerful than professional treatments. They may help maintain results, but rarely deliver the same level of permanent hair reduction. Finally, a rare complication called paradoxical hypertrichosis can occur after laser treatments, where new hair growth appears in areas previously treated. It's uncommon, but slightly more frequent in women with Mediterranean or Middle Eastern heritage. That's why it's critical to work with an experienced practitioner who can tailor treatment and monitor outcomes. In my clinical experience, women achieving the best results often combine approaches: hormonal therapy, topical treatments, and laser or electrolysis sessions. This multi-pronged strategy addresses both the underlying hormonal driver and the existing hair, giving the most effective and lasting results. Let's wrap this up by focusing on long-term strategies, maintenance, and myths about facial hair. First, I want to clear up a common misconception. Removing facial hair does not make it grow back thicker or darker. Shaving, waxing, or laser hair removal does not alter the natural growth pattern of hair. It only affects what's visible on the surface. When it comes to permanent reduction, electrolysis remains the gold standard because it targets and destroys individual follicles. For women with a small, localized area of excess hair, this is ideal. Laser hair removal provides excellent results for broader areas with pigmented hair, though some maintenance sessions may be required if hormones fluctuate later in life. One practical tip for managing facial hair day to day is to combine treatments. For example, a woman using spironolactone may also apply eflornithine cream to slow regrowth and complement laser sessions to target existing hair. This approach addresses the hormonal cause, thins current hairs, and reduces overall visibility. Studies show this combination yields the best long-term results. Consistency is key. Whether you're using creams, oral medications, or in-office treatments, skipping doses or sessions can reduce effectiveness. Patience is crucial. Hair cycles slowly, and visible improvements may take weeks to months. Remember, facial hair is a normal part of being human. Slight peach fuzz is expected for all women, and variations in thickness or pattern are often influenced by genetics, ethnicity, and hormonal status. What matters is understanding the root cause of excess hair and choosing safe, effective ways to manage it, rather than trying unproven or potentially harmful remedies. Finally, self-care and mental well-being are equally important. Many women experience stress or anxiety over facial hair, but educating yourself, seeking professional guidance, and using safe, evidence-based treatments can give confidence and peace of mind. I'd love to hear from you. Have you tried any treatments or hair removal methods that really worked for you? Drop your experiences in the comments below so we can all learn from each other. Thank you for spending time here today, and if you found this video helpful, don't forget to like, subscribe, and hit the bell so you won't miss future videos about skincare, hair care, and dermatology tips. Until next time, take care of your skin, understand your body, and remember, knowledge is the first step to confidence.